Who doesn't want to stop the hands of time? Push back the clock a bit when it comes to growing older. And if going under the knife sounds too extreme, you're not alone. Many people these days are turning to non-surgical, much less invasive techniques. And one of the most popular is dermal fillers. Dr. Ann Therese from Ann Therese Aesthetic Medicine is here to tell us why there is good reason for that. So hi, Dr. Ann.
Nice to be here. Good to see you.
You too. You know, we're talking about this, the areas that show your age the quickest. And I would say your face is probably the first, isn't it?
That is very true. We tend to lose volume, and as we age, we don't tend to lose volume where we want to lose volume, maybe the hips or the belly. We lose it off our face. And so what happens is the face has basically a kind of a descent. It just kind of falls downward a little bit because we lose volume in the cheeks, the temples, and I think we're seeing a picture right now of a young woman, and then what happens as she ages, everything kind of rotates downward. We lose volume under the eyes and in the temples and right around the mouth, so it looks like the mouth turns downward a little bit. And that's all volume loss. That's
all what that is. So you use dermal fillers, obviously, in a lot of ways to treat these areas, but I think while you explain these, the before and after pictures really tell the story when you look at these.
They do, because people will tend to, in a consult with me, take their skin and pull it back and say, well, I just want all this skin gone. Really, you don't want that skin gone. You want it revolumized. You want it kind of plumped back up like it was 10 years ago. So we can use dermal fillers like Restylane, Juvederm, Perlane in the folds just around the mouth and the nose. You can see this lady, the folds right around her nose. We're just getting a little deeper, and it looked like her cheeks were kind of falling downward. So we put some filler right in the nasolabial fold area and right around the corners of her mouth, props the corners of the mouth back up to kind of a neutral position, and it doesn't look like everything's coming downward.
Now, what are our options? You mentioned a few of those different names. It's not just Botox, although we do hear that the most often.
Right, that's kind of the household name. The fillers are things that actually plump, so they don't relax the muscles like the Botox does. They actually plump up the skin in areas of, we get some flattening in the cheeks here, we can get hollowing in the temples, we get the downward turn to the mouth, those little vertical lines around the lips that a lot of women don't like. This lady here, you can just see it just a lot softer from a product called Sculptra. Now, Sculptra is a little different than the other fillers. We don't actually put it in certain lines. We use it all over the face. So we use that in the temples, we use it in the fat pads that are back by the ear, and when that gets in the skin, it grows your own collagen around it. So sometimes Sculptra can last up to 2 years.
And that's a big thing, because I know with some of the other ones, they last only a few months, right?
Exactly. The Restylane, Juvederm, Perlane, those are all hyaluronic acids. And what that is just an immediate plumper. Babies are born with a ton of hyaluronic acid in their skin. When you see their skin, it's plump, it's hydrated, it holds on to water. As we age, we lose that. So the gel fillers like, Perlane, Restylane, Juvederm, those are all hyaluronic acid fillers. Voluma is another big one right now that we use in the cheeks. Wonderful fillers that last maybe 9 to 12 months. Voluma can last sometimes out to 18 months. Sculptra is something kind of different. It builds your own collagen around it. It's like little seeds that generate your own collagen. And basically these pictures that you're seeing right now are just softening in a lot of different areas with Sculptra. So that's in the folds around the mouth and right around the eyes, and it even lifts her cheeks up just a little bit there.
Yeah, it looks like she used Photoshop, but she didn't. She just looked that much younger.
That's how much fun the dermal fillers are, because I will do sometimes half of a woman's face and hand her a mirror before we go to the other half, and it looks like this whole half's been kind of lifted, and it's very dramatic, and it's very, I think when people haven't done fillers before, I stop halfway and let them see that before we inject the other side, and they're very pleased because they can see it looks just like themselves. It's not overdone, it's not overfilled, it just kind of gives them a little lift and a little volume back.
And what about the difference between doing a facelift and a filler? What is the benefit?
Well, basically the downtime is much longer with a facelift, and with a facelift there's cutting, there's usually an incision back by the ear, and the skin is actually pulled back, and it's basically sutured there, so you will have a scar. Even though wonderful surgeons can hide that scar in the ear, it is surgery, so it's a little more downtime, it's cutting. And sometimes the fear with a lot of people is, hey, am I going to look like myself after this? If they're pulled, as we say, a little too tight, sometimes they can look just a little bit different, whereas adding the volume back is something a facelift doesn't do. That's what we can do in the office with just a few simple injections and some ice afterwards, and with the Sculptra, a little bit of massage. You actually massage the face, and those little particles grow your own collagen, and you look very natural after Sculptra.
And let's get to this quickly before we run out of time. We're talking about a big event that you're having, a new location.
Yes, our brand new location at the Polaris area is opening, grand opening party this Thursday.
Okay.
Everything's 20% off. Come have a cocktail and some food with us, 4 to 8. And we're also very proud to be partnering with Firefighters for Kids. If anybody brings an unwrapped toy for that toy drive, we will give people a $100 gift card to spend on anything we do. Or even if you're not interested in some of the more invasive things, you can use that gift card for a free facial. Doesn't everybody need a facial at the holidays?
I love it. Perfect. All right. Thanks so much, Dr. Ann.
Thanks for having me.